Hi everyone, it's Dr. Sharon Wong here. So today we're going to be talking about one of the commonest forms of skin cancer called basal cell carcinomas. Now when we say skin cancer, most people think about the moles that turn cancerous, i.e. melanomas. And whilst that is the most serious form of skin cancer, it isn't the most common. The most common is actually basal cell carcinoma. So as with most skin cancers, the real risk factor and the causative factor is actually excessive sun exposure. And basal cell carcinomas are no different. It's more to do with long-term chronic sun exposure over many years. So most of the time, basal cell carcinomas appear in older people, but occasionally younger people in their 30s and 40s can also develop basal cell carcinoma. There are different types of basal cell carcinomas, but the most common type is what we call nodular basal cell carcinoma. Now, as the name suggests, it forms a little nodule or a little lump on the skin. And typically these lumps would not hurt, they wouldn't typically bleed or cause any physical symptoms, so they can sit very quietly in the skin and just slowly over months to years get bigger. Classically, nodular basal cell carcinomas might have a crust on the surface or a slight dip or a crater in the middle, and those are typically the giveaway signs of a nodular basal cell carcinoma. So whilst basal cell carcinomas are a type of skin cancer, it's really important to know that they are not dangerous to your general health. If left alone, they will grow very slowly over months to years on the surface of the skin, and treatment, which is usually through surgery, is typically curative. The gold standard of treatment of basal cell carcinomas, particularly if it's of the nodular type, is to cut it out. And this is a very minor procedure done whilst you're awake under local anaesthetic. And once that skin specimen has been analysed and confirmed that the entire nodular basal cell cancer is cut out, that is the lesion completely cured with no long-term side effects to yourself. Generally, the misconception is that basal cell carcinomas only appear in the elderly, and that is not the case. So there certainly are people in their late 20s, 30s and 40s who can develop it. Very rarely there are hereditary forms of basal cell carcinoma where patients can develop basal cells at a very early stage, sometimes even in their 20s. But this is a very rare syndrome.